Hi everyone, I'm Dr. Sonal Naidu. I'm a pediatric dentist. I'm here to discuss about what you can do if your child or anybody you know who has a child is suffering from any dental issue. It could be a swelling, it could be a pain, it could be sensitivity, or it could be just a cavity emerging which is causing trouble while eating food and food getting lodged there. So we cannot go to clinics right now. The clinics are closed, and I assume they might be closed for a longer period of time. And as a parent, I also understand that you might not want to take your kid outside as soon as the lockdown gets opened. So what we can do is, let's start categorically. If the child is having pain, suppose there is a tooth in which there is a cavity and it has pain, what can you do? So there are two things which you can do. First is, if the child is having pain, what medicine to give. So you can give the medicine which you give to your child for fever. Suppose your child had fever sometime, the pediatrician must have referred you a medicine with a metered dose according to the weight and age of your own child. So you have to give that metered dose of your fever medication which has been prescribed by a doctor. So it is the safest thing to give to your child, because the pediatrician has seen your child, he knows the weight and the body proportion of your child, according to which the dose has been metered for your child. So give that metered dose of fever medication that will subside the pain. So ideally you could give it thrice for one day. If it's a paracetamol or ibuprofen combination, try to give it for one day. I would not suggest just one dose. I'd say give it 3 doses per day and give it for one day and see if the pain subsides, well and good. If not, then you can continue this dose for 3 days. So this is about the medication which you can give. Other than that, I'd suggest that avoid giving something which is hard in nature. We have to avoid things which are nutty in category or hard, like chickies or nuts. What happens is, when hard substances, when children try to bite on them, there is certain pressure which gets created, and the cavity might have that pressure and the pain might get initiated through that. So we don't want that. I'm not saying that you have to give liquidy diet, but I would really suggest that you give something which is softer and lukewarm in nature. We don't want very hot or very cold food to be introduced. Second thing, so these are the two things which you have to do. The things which you have to avoid is, do not do any hot fermentation. Hot fermentation as in, do not apply anything hot on that area. If the tooth pain is here, you do not have to apply anything hot. You do not have to apply Vicks or any balm or anything. Avoid, so make sure that the child doesn't sit like this on that area, because the heat from the palm can also get transferred and lead to swelling. Okay. If you want, and if it's hurting a lot, which I think if you take the medication will get subside, but in case if you want, you could do a little cold fermentation from outside. But I would like to reserve this cold fermentation also for people who have swelling. Coming to the next category, if your child has swelling. So the swelling can appear in the gum area, or it can appear outside in the cheek. So it can be intraoral as in inside the mouth, or it can be extraoral as in outside the mouth. Both the cases we know that there is an infection inside, alright. This under dental treatment we consider it as an emergency, but right now taking a child to a clinic is again a very risky thing to do. So let's try and work out at home if we can subside it. If not, then you might have to do something. For this, you have to follow the first two things which I said. As in, for pain, you have to give the metered dose of the fever medication which your pediatrician has prescribed for your child. You have to change the diet with no nutty things, nothing which is hard, and then do not apply anything which is hot. If you want to do, you can do a little bit of cold fermentation. Cold fermentation as in, you can take a little bit of ice pack and try to apply on the swelling, nothing which can be hot. The child should not sleep on the side where he is having swelling, because what happens is, with the heat, the blood vessels, I do not want to get inside the technicalities, but then the swelling might increase. Okay. The third thing which you can do is, if there is a swelling, you might give a call to your pediatrician and ask for an antibiotic which you can give to your child. I think I am also a parent and I am in touch with my pediatrician, so you might be able to get in touch with one of them. So just understand that which antibiotic would be safe for your child. I do not want to prescribe something from my end, because I am not sure which allergies your child has or what has been his or her history. So I don't want to get into prescribing something right now, but you should get in touch with your pediatrician and they would be able to help you with what antibiotic you might take for your child, and according to the weight and age of the child, what is a metered dose your child can have. Other than that, in case if nothing of this sorts is there's no swelling, there's no cavity, no pain, still I would suggest all of you all to maintain very strict oral hygiene. Because in the coming months, we know that this lockdown, even if it ends, we are not supposed to go outside. We are not supposed to venture outside, and especially in areas like hospitals and clinics. So to avoid that, what we can do is maintain very good oral hygiene. So with very good oral hygiene, I mean that there should be no food inside the oral cavity. How can we achieve that? There are two things. Brush twice daily, come what may. So brushing twice doesn't mean that now and in afternoon and morning. Once in the morning and once at night. And if under any circumstance you cannot brush twice a day, then it's my earnest request, please brush your children when they sleep at night. That is the most important thing to be followed. So brush them twice, come what may. And after anything which they eat other than water, it could be a glass of milk, juice, crisp, cookies, general food, anything which they have, just ask them to take a sip of water, rinse the mouth and drink it in. This can be very handy. They do not want to go to gargle every time in the washroom. I understand, I have a small child, but at least having a sip of water, gargling in the mouth and then drinking it inside is still doable. Do that. And I would not say avoid sweets altogether, but if you see that your child has a cavity or something, you might avoid something which is very sticky in nature, like chickies, eclairs, melody, or the things which have noga, like 5-star, anything which is sticky, which which sticks on your teeth. We all know that. As children, there's one thing which we need to be aware of is when as adults we have something in our mouth, we have a very good tactile sensation of it. You would like to try your tongue or try your teeth, or you might go to washroom, brush or floss and take it off. But children usually, because in their play mode and all, they don't understand that there's something stuck. So we have to be very careful about their oral hygiene. If you maintain the oral hygiene, I'm very sure the things will not aggravate to a level where you will have to rush them to a clinic. I think these are a few pointers. If you all take care of it, we might not end up into a dental emergency. I would also link up my email ID just in case any of you have any specific doubt regarding a pediatric dental inquiry. You might just get in touch in my mail. And till then, I think stay safe, stay inside. We all will get through this. This too shall pass. All my love to you all.